name's Shahady. We're at the Cardiometabolic Risk Conference in Las Vegas, and I have with me Dr. Saundra Jain. She's a psychologist, and she's with the School of Nursing at the University of Texas in Austin. Welcome.
Thank you, Dr. Shahady. I'm so happy to be here at the conference again this year.
Excellent. She's been out here, what's your third time?
Third year.
Thanks a lot. We had a pre-conference this time on wellness. What was that all about? You want to give us any hints? Because you were there in the middle of it. I think you moderated all of it. Yeah.
Absolutely.
Right.
What a pleasure. The CRS meeting, I think for the first time, offered a half a day pre-conference just for clinicians to focus on their wellness. You know, we come to these meetings to learn about how to take care of patients, the latest and greatest treatment interventions. But wow, we got a half a day to talk about how do we take care of ourselves. We had some great faculty. It was really an enriching afternoon.
So what specifically did you talk about? Or did you have breakout sessions and let people express their own concerns? How did the meeting go?
Yeah, it was kind of interesting. So we had 4 faculty, myself included. We had 2 who really addressed burnout. And what they did that I thought was very unique, they kind of tag teamed together. One presented on the issue of burnout, the issue of clinician suicide. And then the second clinician really dug down and did like a small group workshop. So everyone got to rate their individual wellness. They got to identify their own personal barriers to wellness. What really prevented them.
What are some of those? What prevents them?
It was interesting. People talked about a lot of very different things. Some clinicians felt very isolated, very removed, no contact with colleagues, mostly in private solo practice. That seemed to be high-risk category. Another top on the list was electronic medical records. Wow, I think the entire afternoon could have focused on that. Clinicians really unhappy with the amount of time it's taking away from face-to-face.
And these are primary care physicians.
Primary care clinicians, absolutely. Another very common thing was this issue of the challenge of achieving work-life balance. And then I think an overall umbrella for the theme for the day was, you know, we are teaching life-work balance, exercise, nutrition, good sleep practices, but when we look inward, we see that we're really not walking the walk. So there was a lot of push towards, okay, we've identified the problems, now how do we get closer to achieving that?
And how did you suggest review? Because electronic health records, you got to have the electronic health record people in there, or at least people who could say give us scribes to help us input information. So what type of suggestions did you all come up with?
Yeah, that was probably the #1 recommendation. And there was maybe 20% of the group, there were maybe 125 clinicians present, so maybe about 20% who said in their practice settings they were actually utilizing scribes. And so I think that was kind of the push, that electronic medical records are here to stay. Hopefully they will improve in terms of the amount of time and cumbersomeness of the process, but including a scribe in the room to really allow the clinician to sit face to face rather than you're my patient and I'm doing this and occasionally looking at you.
And you and I as patients have experienced that.
Absolutely. We were just talking about that. Not a fun spot to be in.
No, absolutely. It's difficult as a clinician and more difficult as a patient because you want to be face to face and enjoy that. You know, the American Academy of Family Physicians annual meeting a couple of weeks ago, burnout was a major point of discussion, and electronic health records. And electronic health records really were created for somebody in a subspecialty. So it's going to take a lot of unique work with the electronic health record. What can I do? You know, they're listening to us, so what can we at that primary care doctor, what can he or she do to really work on the burnout that comes from electronic health records?
You know, I think what we said earlier, to enlist the use of a scribe. Because, you know, I think the thing that came out very clear yesterday was that if you compare electronic medical records to pencil and paper, the old days, what would take 2 checks in handwritten form now takes 14 to 15 steps, and that may be an exaggeration, but as an example, for electronic medical records. And I don't think we can as clinicians can really change that.
Sure.
The structure is there, so we're going to have to adapt to it, like everything else that we've adapted to over the years with electronics. But I think what we can do as clinicians is go back to that basic foundation of how do we walk, the wellness that we're teaching.
Right.
Because certainly we're not trying to, I think in a shaming way, say, well, you should be exercising, and then we know that we're not. But to go back to things like exercise, mindfulness meditation, practicing good sleep, staying socially connected.
Mindfulness meditation, what is that? That's a foreign word to mindfulness meditation. I know you've had a couple of breaks here with that. Tell us briefly what that is.
Absolutely. So mindfulness meditation is really from Eastern practices of meditation. It came to the United States, and we began developing lots of variations of different types of mindfulness. And I would say this, after exploring many, I wouldn't say that one trumps another. It's really the practice of being present in the moment. And you can kind of get a good feel for what that is not when you walk down the hall, because you may see people who are very hurried and very busy and looking at the schedule, where's the room, and a little bit frazzled, versus those who are clearly present. They're not lost in their phone, they're sort of in the moment, they're engaging with people as they walk down the hall. That's probably a very good example of being mindfully present.
I call that social, being sociable.
Well, now think about this. You could be sociable, but have you ever been at dinner and sort of looked across the way and seen people sitting, and if not all, at least 4 out of 6 people will have their phone and they'll be texting.
Well, that's like teenage grandkids, that's what they're doing.
That's the curse, the good, the bad, the ugly of social media. So that is a bit of a challenge, but it really is about being present, and in terms of how that's useful to our patients, the data is spectacularly powerful in that it's not just an experience psychologically of, oh, I'm happier or I'm more grateful. Certainly part of it, but the second piece that I think is really interesting to us as clinicians is that the data shows there's a better immune system, less burnout, which is exactly what we're talking about. These neurobiological changes, improvements that impact disease in very positive ways.
Could I say briefly that what you're telling me is quit multitasking?
Yeah, it can be problematic. It's very hard to multitask and be in the moment of any of those various tasks.
Like I'm sitting in a meeting trying to learn something, and I'm playing with my iPhone and filling out an evaluation instead of just learning from what that speaker's trying to get to.
So yesterday when we did the mindful moment on gratitude, what I asked everyone to do before we started was take anything that's a potential distraction, phone, iPad, whatever it is, a piece of paper and pencil, put it underneath your chair, because it really has to be out of sight. It's almost like as a type 1 diabetic, if there's candy on the table, that's all I can look at because I really want it. But if it's not anywhere in the room near me, or I'd have to get in a car to go get it, I'm not going to think about it. So we have to be really proactive and a little bit militant about making sure those things are not in our way.
Dr. Jain, very, very educational and very well put. Thank you.
Thank you. Always a pleasure.
Yes,